Hello everyone. So today we are going to learn about how to make a Jackson's clasp. I have already pre-made a Jackson's clasp on one side, so you have an idea on how a Jackson's clasp is supposed to look. So as you can see, the Jackson's clasp consists of three parts. You have the U that's supposed to approximate your gingival margin, and then you have both your mesial and your distal arms, that occlusal arms that are supposed to come to your mesial and distal side of your molar, and then you have your mesial and distal retentive arms and retentive loops that is again supposed to come on either side of your molar, and it is supposed to adapt onto your palate. So this is how a Jackson's clasp is supposed to look, and we will go about making one on the other side of the cast. So the armamentarium required are your universal plier, your Adams plier, your heavy wire cutter, and a 19 gauge wire which is used for making this particular clasp. So I have already pre-cut a 19 gauge wire to make the same. So now we will be going about making a Jackson's clasp. So first what we need to do is we need to make the U that approximates to your molar. Yes, so what we are going to do is we are going to take the wire, straighten it up a little bit so it will be easy for us to bend, to make the further bends while making the clasp. So you have the loop that you make. You need to make it slightly bigger to ensure that it adapts to your gingival margin. Okay, I'm going to remove this so it doesn't keep falling every time we make it. So I've adapted the U, and as you can see it approximates your gingival margin. So now what we need to do is we need to mark your retentive proximal areas, right? So you have your mesial proximal area and your distal proximal area of your molar. You need to ensure that the wire follows your proximal area. The reason why we do that is to ensure that the clasp gives a better retention. Yes, so now that I've marked it, you can either use a permanent marker or you can use a glass marking pencil for the same. So now that I've marked it, I'm going to take your Adams and I'm going to hold the Adams 1 mm ahead of your marked point. The reason we do that is so when you bend, it bends exactly at the point that you marked. Yes, so when you see sideways, you can make out that there is a mild bend that's come. So we ensure to give that so it follows the groove and the proximal region that's there. Yes, so now what we are going to do is we are going to take the marker again and we are going to mark your distal bend and your mesial side to make your distal occlusal bend and your mesial occlusal bend. Okay, like I mentioned before, you need to take your plier 1 mm ahead of your marking point, and always make a slight bend at first before making an exaggerated bend, just to check whether the place that you're giving the bend is ideal, meaning whether it's right or wrong. So now that the bend that I've given is right, I'm going to go ahead and exaggerate it, make it a nice 90-degree bend. Yes, and check it. It seems fine, but the arms are converging. So what I'm going to do is I'm going to ensure that the arms become parallel again. Okay, the arms look slightly parallel now. Place it. It seems fine. Okay, so we hold the U. The distal arm is adapted, but the mesial arm is still bending upwards. So what we're going to do is we're going to go ahead and exaggerate your mesial arm too. Hold it, exaggerate it, bend it further, and there you go, it's adapted well. So now we take the marker again and then we mark your palatal bends. Yes, the mesial side and the distal side as usual. So what we're going to go do is, like I mentioned it again, 1 mm ahead, bend it, again 1 mm ahead, bend it, check whether it's fine. I can't check because we have excess wire. So what we're going to do is we're going to cut out our excess wire. Always hold the wire that we're going to cut so it doesn't fly out and go hurt someone or injure someone. So now we placed it. It seems okay. So we're going to go ahead and give the retentive loops and then we will go ahead and adapt your retentive arms to your palate. So now your retentive loops should always be on the same side, like the mesial arm and you have your distal retentive arm. So you can either give the loop towards your distal or towards your mesial, but we want that both the arms should face the same side. So I'm going to go ahead, bend it. I'm going to go ahead and bend this also. We're going and pressing it ahead a little bit. Do the same for this arm as well, and place it. Okay, so now you can see it's adapting onto the labial side. The occlusal surface is adapted, but your palatal bends are not. So now we will go ahead and exaggerate the bend again. So this time I'm going to use the universal plier to exaggerate the bend, because the tip of the universal plier is generally thinner than the tip of our Adams plier. So it's extremely useful in a case like this. I have placed it. The mesial arm is better, but the distal arm is not. So we're going to go ahead and bend it further and give a mild bend, or just like a mild convexity onto your retentive arms, so it adapts to your palate very smoothly, right? So now we place it, okay, and we exaggerate this bend. There we go. You can see how the distal arm was jutting out, but I've given a mild convexity bend to adapt the shape of the palate. And you have your mesial arm, you have your distal arm, and it adapts quite fine. So this is your Jackson's. I'm going to place the pre-made Jackson's on either side. So as you can see, I've turned the loops, retentive loops distal on this side, whereas this retentive loops are mesial on this side. It really doesn't matter, but you need to be warned whenever we acrylize an appliance, it's gonna go up till mid of your second molar and it's gonna go all the way till here, right? So we don't want the wire to be jutting out. So in cases like that, what we can do is you mark it midway, like the mid portion of your arm, and just give a mild mesial bend. So the reason that we do that is to ensure that the wire doesn't jut out when we are acrylizing the appliance, and at the same time we are not losing any retention. See, I hope you can make out the difference between this and this. Here, when we make your acrylization and trim your appliance, the wire is going to be jut out, whereas in this side it's not going to jut out. So I would suggest, if at all we go ahead and give a Jackson's for a patient, please give this mesial bend, and then once you give the mesial bend, you will again have to adapt it further, because we don't want it jutting out. And if it juts out, what we usually tend to do is we'll place like a thick acrylic, and that's going to be extremely uncomfortable for the patient. So we don't want to do that, right? So now this is how a Jackson's looks, right? Follows your gingival margin, mesial and occlusal bends, and then you have your retentive arms. And this, for this particular Adams, the mesial bend is given, so it adapts more mesially when you're going to acrylize it. For this particular Jackson's, we just give a straight bend. I hope this video was useful. Thank you.